We start tonight on KXAN News at 10 with a look at a record-breaking number of COVID patients in the Austin metro area. 620 people are in the hospital, 162 are on ventilators, the highest numbers we have ever seen here in Austin.
And we are one short of the record number of patients in our ICUs. Right now, the 11-county hospital region only has 3 available ICU beds.
And local health officials say we still haven't reached our peak. They think this could happen in the coming weeks.
KXAN investigator Kevin Clark asked about the factors that make this surge different from previous spikes.
A Friday afternoon trip to the park. It's how Tom McFarland's son ends the first week of school.
We have to just take it one day at a time and pray that we all survive this.
But McFarland says it's hard to pretend all is normal when COVID-19 cases are spiking again. And the return of school is why Austin Public Health says it could get even worse before things improve.
With school starting this week, we can anticipate that we're going to see increased numbers over the next week or two before things get better.
Local health officials say their projection is based on the Austin area's handling of the H1N1 flu season in 2009. They also added there's a backlog of cases to be counted. But Caitlin Johnson with UT's Modeling Consortium says there are new variables that make this situation unpredictable. The Delta variant for one, but also a large unvaccinated school-age population.
We hope that with mitigation measures and continued social distancing and face mask usage, we will turn that corner, but it's really too early to tell right now.
Austin Public Health says it could take weeks to identify hotspots in schools, an anxiety-inducing time for both kids and parents.
It's a crapshoot. Nobody knows, and it is scary, and it could get worse, and I suspect it will. We might have to pull out and get into a pod again in a couple of weeks.
Kevin Clark, KXAN News.
To give you an idea of where we are this year compared to the start of the last school year, right now there are more than 13,000 active COVID cases in the Austin metro area. At the same time last year, there were just 4,400 active cases.
Austin Public Health is advising even vaccinated people to avoid large crowds, but if you do go out, wear a mask, they say, and stay socially distant. There are dozens of large events scheduled at the Austin Convention Center and Palmer Event Center over the next few months. There will be masks required at these events to comply with the city's mandate from last